Hey everybody, welcome back to CoronaChat. I'm Caitlin, and today is Wednesday, May 27th. And over the past few weeks here on CoronaChat, we've talked a lot about lockdown policies, how they get implemented as a last resort when testing, contact tracing, and selective quarantine don't work, how they're really, really hard, and how when used appropriately, they can help us to flatten the curve. But what we haven't talked about as much is that there's a lot of space for nuance in different types of closure orders, and that not all stay-at-home orders are created the same. Some stay-at-home orders are actually more supportive of public health than others, and the way that stay-at-home orders are rolled out and enforced can have a really big impact on whether these policies are overall helpful or harmful for public health and well-being. And the implementation of these policies may affect different groups in society in different ways. What might seem fine in theory to one group could actually be devastating to another group. For example, if I work from home, or I can work from home, and I don't have small kids, that stay-at-home policy might not seem that bad to me, right? Like I don't have to commute, I can wear sweatpants all the time, right? But if I depend on selling food on the street to earn my living, an indefinite stay-at-home order might effectively be a death sentence for me and my family. So this is important to think about so that we come up with policies that don't harm people unnecessarily, and so that we can ensure that the implementation of these policies is fair to everyone. So before we get any further into today's video, I want to caveat that this video is based on work that I'm personally doing right now, some research that I'm working on, rather than sharing a publication or a preprint by somebody else that's already in circulation. So this will be a little different than most of our Corona chats, but hopefully interesting and useful. And in thinking about this issue, I'm really heavily indebted to several groups of legal scholars, specifically those coming out of the international law, human rights, and critical race theory traditions. And one thing that Rajat Khosla, the human rights advisor to the World Health Organization, once told me was that although most of us tend to think about the law as something that outlines rules and punishment for breaking rules, law is actually much more complicated and has many more applications. For example, legislation can create programs, assign funding to those programs, and define who has access and under what circumstances. Right? So some examples of this are the laws that created Social Security or that provide free and reduced lunch and breakfast to kids who live in poverty at school. And these are classic examples of public health policies where the law was used to create supports for people to be healthy. In other words, not all public health policies need police enforcement. This is particularly important when we think about something like a stay-at-home policy or a social distancing policy. Right? One way to view such policies is as an opportunity to criminalize behavior, such as being outside your home or not wearing a mask. And we've seen communities all over the world adopt this kind of approach, right? Arresting or fining people who were caught violating such orders. But another way to approach these exact same policies is thinking of them as a trigger for governments to create support programs. So for example, the National School Lunch Program entitles low-income kids to get free or reduced price lunch and breakfast at school. Now, normally, if a kid stays home from school, no one shows up with a meal for that kid, meaning that staying home from school might mean going without a meal. But with a society-wide school closure, we now may have the opportunity to make that program more flexible and allow for meals to be sent to home. And maybe we can actually make it even more flexible and provide meals for a whole family rather than just for that one school-age kid. And since we're going to that home to drop off the meal, we can talk to the family and see if there's other support that they could really use. This then becomes an opportunity to better understand what our community needs and connect people to services that could help them. From a public health perspective, this second way of implementing a stay-at-home order, where it becomes an opportunity to extend support out into the community, is much better than just locking up the parents because they went outside to sell food on the street, right, and didn't comply with the stay-at-home order. Both of these different approaches flow from the same idea of a stay-at-home policy, but represent different paths towards implementation. Decades of public health experience show that supportive policies tend to be more effective than bans and criminalization. Supportive policies also tend to engender much less backlash. And supportive policies get us away from violent confrontations between police and individuals, which can quickly spiral out of control, particularly if there are other background issues like bias and mistrust that make police-community interactions really fraught. The point of all this is that although it can be tempting to want to call the police and just arrest everyone who seems like they're doing things that could put public health at risk, like, congregating on the street or not wearing their mask, the truth is that those kinds of actions actually harm public health and well-being far more than they help. And as a public health community, but also as members of a democratic society, we need to be advocating for policies that are actually going to help keep our communities safe, not just those that might seem like a good idea at first blush. So that's our show for today. We will see you all back here tomorrow on Corona Chat. Thanks for tuning in. In the meantime, remember, we are all in this together. Stay safe. Take care of each other. We'll talk soon.